How is a CEA tumor marker test baseline determined? Have you ever wondered how doctors determine the baseline for the Carcinoembryonic Antigen tumor marker test? This is an important step in managing colon cancer and other related cancers. The baseline is established by measuring the patient's CEA level in the blood before any treatment begins or at the time of initial diagnosis. This initial measurement serves as a reference point for monitoring changes over time, especially to assess how well treatment is working or to detect any recurrence of cancer. To determine this baseline, a blood test is performed. This test quantifies the amount of CEA, which is a protein that can be elevated in certain cancers, particularly colon cancer. The measurement is typically done using a specific method known as a sandwich immunoenzymatic assay. This technique involves using monoclonal antibodies that specifically target CEA, producing a signal that is proportional to the concentration of CEA in the blood. It is crucial to use the same testing method consistently when establishing and comparing baseline and follow-up levels. CEA levels can vary depending on the assay method and the equipment used. If there is a change in the testing platform or assay, clinicians need to establish a new baseline with the new method. This is because values obtained from different assays cannot be directly compared. The baseline CEA level provides insight into the tumor burden and can have prognostic value in colon cancer. Generally, higher baseline CEA levels are associated with more advanced disease and a poorer prognosis. This initial measurement can help predict how effective treatment might be, especially in cases of metastatic colorectal cancer, where it can guide therapy decisions and monitor responses to targeted treatments. Timing is also essential. The baseline CEA level should ideally be measured before any treatment, such as surgery, chemotherapy, or targeted therapy, begins. This ensures that the measurement accurately reflects the tumor's activity. Subsequent CEA tests are then compared against this baseline to detect any increases that might indicate recurrence or progression, or decreases that suggest the treatment is effective. It's important to note that while CEA can be elevated in cancer, it can also be raised in non-cancerous conditions. Therefore, determining the baseline must be interpreted alongside clinical findings and other diagnostic information. The CEA test is not a standalone diagnostic tool, but rather part of a broader clinical assessment of colon health and cancer management. In summary, the baseline for the CEA tumor marker test is determined through an initial blood measurement of CEA levels before treatment starts. This process uses consistent assay methods to ensure reliable monitoring over time. Establishing this baseline is vital for tracking the progression of colon cancer and evaluating the response to therapy. Always consult with healthcare professionals for personalized medical advice and guidance.